If you've got any questions, just save them till the end. I hope you've got some water, you've been to the toilet, and you've got your little notebooks ready, because I encourage you to take as many notes as possible during this session, and I'll be opening up the floor for questions right at the end if you've got anything that you'd like to know more about. Okay, so let's see if this is going to work for me. Here we go. So which one are you? No, it wouldn't let me do number 1 first. I don't know why. Number 4. Do you want to improve the quality of your eggs? Is this you? Is this why you are here tonight? You want to improve your egg quality? Or are you struggling with unexplained infertility? So is that something that you've been to your doctor, they don't know why you can't get pregnant, it's just unexplained? Have you got PCOS? Maybe you've got issues with weight gain, or maybe you've got a really irregular cycle as a result of that. Maybe you're currently going through IVF at the moment. Tonight is for those women who are currently going through IVF and are looking for answers about why it potentially hasn't been successful. Or maybe you are looking at going through IVF, but you want to try and avoid it because of all the pain. So maybe you've read about the first 1,000 days of life and you want to make your nutrition count. Maybe you've heard about how important it is to ensure you are optimizing your nutrition prior to getting pregnant, and you want to make those first 1,000 days count. That's the first 1,000 days of your child's life. So maybe that's you tonight. Maybe it's important for you to prevent your child from getting things like diabetes or developing chronic diseases like heart disease. Maybe you've got endometriosis, like one of the patients here tonight. So, and you're struggling maybe with low implantation rates there. Oh, Sally, IVF, same-sex relationship. I see a lot of individuals who are in that situation, and I love supporting them. I've got one couple at the moment who I've just helped to improve their egg quality, and they are going for transfer next week, so I'm excited about that. You'll get to know me a little bit through this chat tonight, but I get very involved and people text me sometimes about the fact that they've ovulated and they're really excited about it. Oh, second transfer next week as well, Sally. How exciting. Okay, your doctor's told you that you need to lose weight and you don't know where to start. I have so many patients who come in and see me and they have doctors who sometimes aren't very nice about this and aren't very kind about the way they support people. But I want you to know that I am a health at every size advocate. I love working with women and men of all shapes and sizes. And I'm very understanding of this and have a lot of experience in this area as well. And maybe you've heard that nutrition matters for conception, but you don't know why. So I hope that tonight we will cover off some of this for you. Okay, I would like you to close your eyes now, and I want you to imagine this time next year, okay? You've got your routine with your food and your eating, and you know when you're hungry and you know when you're full. You feel energized when you wake up in the morning, and you're confident in your body's ability to create life. You feel a sense of calm because you know that you've done everything possible to get pregnant. Maybe this time next year, you're even sitting there with your ginger tea to fight off that nausea, and you can feel a little kick, kick, kick of feed in your belly. Now, I want you to open your eyes and be aware that this is not a pipe dream, okay? You can enhance your fertility. And with my help, you can get pregnant by the end of the year, okay? This is a possibility for you. And it doesn't matter if you've been trying for 3, 6, 12 months or even years. I have seen time and time again in my practice and in the research how nutrition can improve women's fertility, how it can help you get pregnant faster, how it can enhance your egg quality, how it can decrease inflammation in your body, and how it can help to regulate your cycles. So our purpose today is to help you walk away from this webinar with absolute clarity on the 3 most important things you must do to enhance your fertility and increase your chances of getting pregnant this year. These are sort of non-negotiables. So you would be absolutely mad to try to get pregnant without doing these 3 things. And I will also explain how I can help you not only to enhance your fertility, but also how you can do it with the confidence and support that you need to do so. We've had a few newbies joining. Please let me know where you are coming from. So, first of all, I would like to introduce myself. My name is Rachel, and I am a university qualified accredited practicing dietitian. So that means that I am to be held accountable for the work that I do. I am held to a very high standard. It also means you can claim through Bupa and Medicare on me. I'm a certified fertility and pregnancy dietitian. So I have gone on to do additional training in this space, and it is the space that I work in now. I'm very, very passionate about working here. I am also a fellow fertility warrior. So I've been on my own fertility journey, which has brought me here today. And it's one of the reasons why I do what I do. I went through a very painful miscarriage, both emotionally and physically. And it got me questioning what nutrition can do for this and how it can decrease your chances. Now, it's absolutely incredible how much it can affect you and how much it can enhance your fertility. And it is now my mission to help as many women as possible get pregnant. That is why I'm here. I am very lucky to be a mother of 2. And I would love to help you have a family as well. So here's some of the things that my clients say about me. You are very welcome to look at my Google reviews. They will tell you even more information. There are things that I can't say specifically, so I can't tell you I got this person pregnant because that's talking about outcomes. And as an accredited practicing dietitian, that's against the process that we're allowed to do in terms of advertising. But I can tell you that my clients say I'm caring and supportive, professional, experienced, and I'm very good at providing personalized advice. Okay. I also happen to think I'm a little bit hilarious at times, but I'll let you be the judge of that. Pina colada is my favorite cocktail. I love comedy. I love Zumba dancing as well. Are there any other Zumba ladies here? So here's one of the testimonials that I can share with you. Without a oh, Rochelle, we're so similar. You love Zumba too. Okay, so what my patients have to say. Without a doubt, I would recommend Women's Nutrition Rachel to anyone who is wanting to take control of their health and get as much support wrapped around them for conceiving and pregnancy. I was referred to Rachel by my fertility specialist to educate myself on how to nourish my body the way it deserves to prepare to conceive later this year. Working with Rachel has changed my life and my relationship with food. I feel happier in my own body and mind, and I have so much more energy to keep showing up for myself each day like I deserve. That is from Lara, one of my beautiful patients who I worked with on a program called Full Circle Fertility. She is absolutely wonderful, and I am so proud of what she's achieved since we worked together. This is another one of my beautiful patients, Emily. You know how motivated and happy you feel when you spend time with a supportive, positive friend. That's exactly what it feels like when you see Rachel. Rachel helped me when doctors couldn't and I had lost all hope. Rachel made me feel heard and understood and ensured that her advice could fit within my lifestyle, making practical suggestions that I could actually stick to rather than idealistic recommendations that wouldn't work long term. Rachel has helped me to tune into my body and to listen to what it needs. I feel much happier, healthier, and more confident in my own skin and would not be feeling this way without Rachel's support. I cried when I read that one. It's just so beautiful. And I would love to give you some of that support as well. Now, that's some of the, personal feedback that I've got about me, but this is some interesting research around fertility and nutrition. There is heaps of research coming out on a day-to-day basis about how important fertility nutrition is. So this is one research called The Influence of Metabolic Factors and Diet on Fertility. I don't need you to know what that means. I've summarized the key point for you here. This is just one example. So consuming 5% of energy from plant proteins like lentils, tofu instead of animal protein reduces the risk of anovulatory infertility by over 50%. So that's when you're not releasing an egg, okay? That substituting 5% of the energy requirements of carbohydrates with vegetable protein can reduce the risk of ovulatory disorders by up to 43%. Okay, that is absolutely incredible. So if we add a little bit more plant protein into our diet, we're going to get pregnant a bit faster. This is one of the stats that I use to promote my webinar. Have you heard of Harvard University? So the research indicates that nutrition can increase your chances of pregnancy by up to 70%. So what this means is that if you make some specific changes to your diet, then you can increase your chances of falling pregnant. Okay. So let's get started, ladies. Here's what we're going to share tonight. This is the process that I've followed to help hundreds of women enhance their fertility. Okay. Secret number one. So this is the first thing that we're going to cover off tonight. The key nutrients you need to include in your diet. You'll have to excuse me, I've got a little bit of a scratchy throat at the moment. You can probably hear it. I don't normally sound like a husky jazz singer. Secret number two, supplement timing and why it matters. Secret number three, why you need to get your pathology tested and which ones to look at prior to trying to conceive. So, which secret are you most excited for? I would love it if you could comment in the chat box now. Awesome. Melody's keen on the pathology. Sarah, number three. Vanessa, all of them. Great. Awesome, guys. Love this. So let's get started, shall we? Secret number one. So here's some key nutrients you need to be aware of for your fertility journey. Obviously, I cannot cover off every single nutrient that you need to be aware of. So let's just talk about a couple of them tonight. And I think it's really important to note here that we can look at key nutrients, but you still need to make sure you're eating fabulous food. And if you work with me, I promise you that you will still be eating enjoyable, wonderful food. Food is life. And it's really important to be enjoying it. I don't want to put you on a really strict fertility diet that you're not going to follow. Okay, that's really, really important to me. If you're happy about that, comment, woohoo. So, folic acid. Now, I'm sure a lot of you have heard about folic acid, but I've got some new information to share with you tonight, which you might not be aware of. So folic acid is sort of one of the more obvious ones, and so many women are still getting this part wrong that I see in my clinic. So we know that it's important to reduce neural tube defects, but higher intake from supplements can also help to reduce your risk of miscarriage. So it's something that we need to get right and we need to personalize for you. So why does folic acid matter? Well, just touching off, it's a type of B vitamin. It's involved in many functions around the body, including making red blood cells. Folate is a natural form of the vitamin found in food. Folic acid is a synthetic form that's added to your supplements. So during pregnancy, it's really essential for synthesis of DNA, cell growth, fetal development, and development of your baby's nervous system. So some of you probably know about this already, but inadequate folic acid prior to conception could increase the risk of your baby developing neural tube defects such as spina bifida. So the recommendations are that you need to consume a diet rich in folate, that you need to supplement your diet with a minimum of 600 micrograms of folic acid, and you need to start your folic acid supplement as early as possible in your TTC journey, at least 1 month prior to conception. So here's some of the food sources that I recommend for folate. One of my favorites is the legumes, although they do make me a little bit gassy. Now, this is the important part to note, and this is where a lot of women go wrong. There is no one-size-fits-all approach when it comes to folic acid and dosage, okay? So there was some really interesting research which came out a number of years ago, and it showed that some women actually benefit from higher doses of folic acid in pregnancy, and in doing so, they reduce their risk of having a miscarriage. So you can see here, if you've got previous pregnancies with neural tube defects, if you've got diabetes, if you've got a malabsorptive disorder like celiac disease or IBS, or if you're obese, then it potentially could be the case that you need to take a little bit more folic acid. And that's not something that a lot of doctors are aware of, including your obstetrician and gynecologist. I don't see a lot of people who are needing excessive folic acid being put on that automatically. It's the fertility dietitians that are getting involved here. So let's talk about another mineral. Some of you maybe know about zinc. It's a key nutrient that I see often overlooked on your fertility journey. I'm curious if anyone is currently on a high dose zinc supplement. Comment in the chat if you are. It's something that a lot of people come in and they are on a higher dose of zinc. Some of you might have heard that it can improve endometriosis or that it can improve egg quality. So why should you consider zinc? It's an essential mineral that the body cannot make on its own. So it's one of the basic building blocks for new cells. It's involved in many bodily functions, including enzyme production, enzyme reactions, immunity, and insulin regulation. Very important, because insulin has a flow-on effect to all of your other fertility hormones, your luteinizing hormone, your estrogen levels, your progesterone levels. It's a crucial mineral for fertility and pregnancy. So it's essential for that rapid cell growth needed for conception. And the evidence suggests that low zinc intake may result in a longer TTC journey. So it might take you longer to fall pregnant naturally if you've got low zinc levels and low intake. Another study found that there was a link between low zinc levels and low ovarian reserve. So AMH, if you've had your AMH tested, that's an indicator of how many eggs you have. And there's a link there between zinc and AMH levels. And another study found that taking a high dose zinc could improve IVF outcomes for some women. Okay, now please don't rush off and start taking zinc immediately. You need to make sure you're getting the dosage right and that it's personalized for you. And then on the other side, zinc deficiency also indicates that it could disrupt the development of fertilized eggs. So if you've gone for some egg collections and your eggs haven't sort of developed throughout the process there that they should into a blastocyst, that could be an issue with your zinc. It can also lead to impaired immune function. And it's also very, very critical for ovulatory fertility. Okay, so very important one there. This is one particular study, and I've just pulled out some of the information from there. Zinc deficiency can have lasting effects on the development of the embryo. For example, embryos are 31% smaller in size with a high 46% mortality rate on day 10.5. Okay, so some of you might have fresh embryo transfers and have losses around that day 10 mark. This could be potentially related to zinc. So it's a really important thing to be looking at and considering. Here's some food sources of zinc, talks a little bit more about supplementation, but really important to make sure you do talk to someone before you start taking a higher dose of zinc. There's a couple of things we need to factor in there. Keep in mind that zinc intake and absorption can be altered by regular alcohol consumption, and it could be affected by malabsorptive conditions such as Crohn's or celiac disease. Okay, let's have a bit of a chat about niacin, another one to be aware of. This B vitamin is essential for fertility, and new research is emerging that insufficient intake can impact your baby's risk of developing birth defects, and it can affect your miscarriage risk. So here's one of the studies that I looked at. And this is what the results were. Inadequate maternal niacin intake is associated with an increased risk of congenital anomalies in the offspring. Okay. So why don't we know more about this, right? Like, if you're going through a pregnancy, we need to make sure you're having enough niacin. It's really important. So where can you get niacin from? Fish, lean meats and poultry, whole grain cereals and nuts, eggs and dairy products. So for most individuals, they're getting enough niacin from their diet. But if you are encountering multiple miscarriages, it's definitely something that I am looking into. Are you getting enough niacin from your intake? Vegetarians are at high risk of inadequate niacin. All right, so here's a bit of a recap of those nutrients and why they matter. So folic acid, you need to make sure you get dosages right to reduce the risk of those neural tube defects. Remember, dosages vary person to person, depending if you've got diabetes, if you're obese, if you've got a malabsorptive disorder. Zinc, we want to make sure we're getting enough of that from our diet, and maybe we want to consider a high dose to improve our egg quality and implantation rates. Niacin, we want to decrease risk of birth defects and decrease risk of miscarriage. So those are our key nutrients and why they matter. All right, who's ready for secret number 2? So, supplement timing and why it matters. All right. Now, I just want to say, I'm sorry we can't go through all the supplements today, but let's talk about a few and why it's important that you don't take them at the same time. Supplements are, just be aware that supplements are the sort of icing on the cake as well. You need to get your diet and your intake right first. And then once we've done that, we look at supplementation, okay, and whether or not it's necessary. I see a lot of women come into my clinic who are taking lots and lots of supplements, and sometimes they're not taking them at the right time. So let's talk about why that matters. Okay. There are some fat-soluble vitamins that you need to be aware of. So, fat-soluble vitamins is D, A, K, and E. Now, vitamin D and vitamin E are two of the ones that are commonly taken on your fertility journey. And it's really important that you take them with some fats, some good fats preferably. So something like omega-3 fats found in oily fish, or maybe some olive oil. So really important that you take those supplements during that time. Otherwise, they're not going to be absorbed properly, and you're just essentially they come out in your urine. The other supplements to be aware of here are magnesium, calcium, iron, and zinc. Now, you need to avoid taking these at the same time, and that is because they fight for absorption. So a lot of women I see are taking iron, and they're also taking zinc, and they take them at the same time, and they sort of are cancelling each other out in occasions. So if you've got low iron, take a note here. If you're on an iron supplement, you don't want to be taking it at the same time. So, for example, if you've got an iron supplement and you're then having a big coffee, which is a really milky coffee, which has lots of calcium in it, you don't want to be taking it at that time because you're wasting your money. It's not going to be absorbed properly. Okay? So sometimes it doesn't matter when you take them, except when it does, okay? I put a little picture here of some omega-3s. Omega-3s are one of my favorite supplements to prescribe to my patients. And that's because there's a huge amount of research out there looking at how wonderful omega-3s are for fertility, for your health, for brain health, for your unborn baby as well. But while it doesn't matter what time you take omega-3s, I've found that if you take them in the morning, you end up having fishy burps all day long. Has anyone else experienced this? So even though you can take it any time of day, I do recommend taking omega-3s at nighttime to avoid those fishy burps. All right. And that is why supplement timing matters, okay? So we want to make sure we're having fat-soluble vitamins with a meal that contains some fat. We want to be having our iron and zinc not at the same time because they're going to fight for absorption. And we want to be taking our fish oil tablets so we don't have fishy burps all day long. I'm not sure if anybody wants that. Alrighty, secret number 3, why you need to get your pathology tested prior to conception. I'm actually curious, and I just want to take a little moment here to hear from some of you. Have you had your pathology tested as part of your conception journey? And do you think you've had all of it done? Do you think it was the right stuff? So many blood tests, Rochelle. Oh, I hear you, babe. Yeah. Yes. I see this so much at the start, not ongoing throughout the journey. So you maybe done egg collection, Sally, like a year ago, and then they keep doing implantations, but they're not checking how you're going. Well, someone's had it done multiple times. That's great. Okay, so let's talk about why you need to get it done and some of the key nutrients and minerals. And I really hope that you've had a really good, thorough blood test done because it's really, really important to make sure you're getting the right test done. So let's have a look. Iron. This is one that lots of people miss out on, or they get done and then they don't get it checked again. So consumption of iron supplements and non-heme iron from other sources may decrease the risk of ovulatory infertility. Okay. So essentially, we know from the research that if your iron levels aren't right, then it decreases your chance of having a successful egg collection, successful implantation, and successful pregnancy. This is another one that sometimes women don't get checked, is your CRP, C-reactive protein. So this is the research from 2023, really interesting, very recent, very current. Among women of normal weight undergoing their first IVF treatment, high baseline serum levels of CRP, which many people don't get checked, are associated with reduced clinical pregnancy and live birth rates following fresh ET cycles compared with low serum levels of CRP. So what this tells us is that low-grade inflammation may be harmful to IVF outcomes, okay? And that CRP is measuring that inflammatory response, okay? And that's why in my program, I talk to you about inflammation and how we can decrease that. We check in on it and make sure things are tracking okay there, because we don't want that inflammation to be there. I want you to have your fresh cycle be successful. Does that sound good? All right. Now, this can be hard to see, and I understand. I've been through a miscarriage myself. I was vitamin D deficient in my first pregnancy. I wish I'd known that I needed to make sure that I wasn't deficient. I now know, and I'm here to share this information with you. So this study looked at vitamin D in miscarriage. Now, lots of people get this tested prior to conception. However, there's a healthy range, and there is a range we are aiming for when we're trying to conceive, which is actually a little bit higher than what your doctors can see and what they think it should be. All right. And that's because vitamin D is required to help make a baby, essentially. So it gets used up during that pregnancy process, and your levels can drop quite significantly throughout your pregnancy. So for me, I think I got mine tested at 20 weeks and it was very, very low. We want to make sure it's optimized prior to you even getting pregnant, okay? And that's going to help decrease your risk of miscarriage. So that's something I look at with all of my clients. So, recap. Pathology results matter. Your blood tests tell us a lot about your chances of conceiving. Fertility dietitians are best placed to ensure you're meeting your nutrient requirements, okay? Now, if your pathology, I'll go through those questions a bit later if that's all right. If things aren't right, it can take you longer to get pregnant. It's really important to ensure your levels are optimized, okay? So this is secret number 3. You would be mad to go down the route of trying for a baby before you've had some of these key blood tests conducted. And this is where fertility dietitians excel. So as a certified fertility dietitian, I've been trained specifically in this area. I'm experienced and know the dosages of supplements to be optimized for your nutritional status. So you can see why this is important, all right? Now, was anything surprising for you here? Was there any things that you weren't quite sure about, or did you learn something new there? Let me know in the chat, please. Yeah, niacin's not a very common one that people are aware of. And there's lots of other nutrients here that I haven't had time to talk about today. Yeah, CRPs. Great. So this is what we've covered off today. The key nutrients you need to include in your diet. Supplement timing and why it matters. Okay. And why you need to get your pathology tested prior to trying to conceive. Okay. So these are really, really important to get right, okay? We need to make sure that you've got those nutrients right in your diet so that you can increase your chances of getting pregnant. We need to make sure you're taking your supplements at the right time. That's a really interesting question. I'll answer that in a moment. why you need to get your pathology tested prior to trying to conceive. So it's really, really important. You want to be seeing a fertility dietitian so they can help you figure out which numbers are right, because I can tell you right now, of the gynecologists and obstetricians and IVF specialists that I work with, I have not had one of them check everything properly. Actually, I've had one and they missed something. Okay, one of all of the people that I work with, and I work with a lot. Okay. So today I have shown you that nutritional factors influence your time to pregnancy, your miscarriage rates, your egg quality, your live birth rates, and your IVF success rates. Okay, it's really, really important. So I would like to know, do you agree that today's session has been time well spent? Now, obviously, I can't cover everything you need in this webinar, but I've got a special offer so you can get everything you need to know, okay? And if you act fast, I'm going to give you a really super special price tonight, okay? I would love to work with all of you here tonight to help you get pregnant faster, to enhance your fertility this year. The question is, do you want to feel stressed and alone? Because it's stressful, right? It's really, really stressful. Or do you want to feel confident and supported and have someone there holding your hand the whole way? Let me know. I would like to join me in my full circle fertility program. I'd like you to empower yourself. So this program, I have developed it to be everything you possibly need to get pregnant and enhance your fertility. Okay? So one-on-one support. You get 8 individual sessions with me, so weekly sessions over a 2-month period. You get premium access with guaranteed response to any questions within 24 hours, even on the weekends, even on holidays. You get pathology support and supplements. So I talked to you tonight about getting that pathology tested and how important it is and how doctors often miss some of the key areas there. So I give you all the guidance you need around that pathology. And I also give you vaginal microbiome screening as part of the program too. So that is to make sure if you're having issues with implantation rates, there's nothing nasty going on down there that's affecting your chances of having a successful implantation. You also, as part of the program, get all of your supplements included for 2 whole months. So I pay for all of it, I order it for you, and it gets delivered to your door. Who would like to take all the stress out of all the supplements that you need and have it delivered direct to you, including a plan of when to take them and how much to take? It also includes meal guidance and dietary analysis. So someone in the chat just asked, how much niacin should I be taking? I go through your food diaries and I do a full dietary analysis there, okay? And we find out where you might be lacking. Are you having enough niacin? Do you have enough zinc in your diet? Are you getting enough calcium? I figure that out for you. We go through it together and we look at which supplements you actually need and which ones you don't. Because I think it's important that we don't put you on supplements if you don't need to take them, okay? Food first is my approach. Let's enjoy what we're eating and we'll use the supplements as icing on the cake, okay? The other thing, and I haven't had a huge amount of time to talk about this tonight, but you get all the home care products, so shampoo, conditioner, body wash, deodorant, and personal products, dishwashing powder, cleaning products, all organic, to reduce your inflammatory response within your body, okay, and optimize your fertility. Actually, 2 seconds. Did I didn't mention this. Sorry. You get your personalized meals plans and you get all your snacks for 2 whole months. So you just need to take care of breakfast, lunch, and dinner. I'll sort your snacks for you and they get delivered to your door. Forgot to mention that. So getting our snacks, our meal guides, the dietary analysis, all the things you need to help enhance your fertility, okay? All the home care products, personal products to reduce inflammation, optimize your fertility. I have come up with this program to tick every single box you need to enhance your chances of getting pregnant, okay? No more guesswork. You get the confidence you need. I'm here to understand and listen to you and give you 24/7 support, okay? The best part comes with a pregnancy guarantee, okay? Who's surprised by that? So let me tell you about it. As I just mentioned, more than $10,000 value with all of this. Your meal guides, your supplements, your snacks, your pathology guidance, your vaginal microbiome testing, all the care and support you need for 2 whole months. Yes, Rochelle, even for 39-year-olds, and a pregnancy guarantee, okay? Now, it's not $10,000 tonight though, okay? I want to let you know that right now. This is a special offer just for tonight. Normally this program is $6,000, okay? But tonight, and I've never done this before, and honestly, it's a big risk for me because it cuts a lot of it for me. It's $5,000 for the next 48 hours, okay? And here is the link for you to purchase online. Now you can pay in full using my online shop and PayPal. And this is included in the pregnancy guarantee. So if you are not, this is how it works. If you're not pregnant within 6 months of having started working with me, and if you take all of my guidance and do everything that we have discussed, then I will give you half of your money back. Okay? So not only tonight do you get a $1,000 discount, normally $6,000, only $5,000 tonight, and for the next 48 hours. And if you are not pregnant in 6 months, I will give you half of your money back. And you get to keep all of those supplements, all of that knowledge, all of those meal guides. It's a very good offer, and I have never done it before. So I would love to see some of you joining me. Now, are there any questions on any of that? If you're too shy to message me on here, feel free to send me an email after the session's finished today. I'm just going to go through some of those other questions that were asked a little bit earlier. So let's have a look. What number should we have for vitamin D on a blood test? For those of you that are trying to get pregnant, we're aiming for it to be optimized at around 100 on that blood test. Questions. Is it true that we should only be taking vitamin D in the morning and not evening together with fish oil? Else, high chance we can't go to bed. No, I don't believe that is true. You can take your vitamin D and omega-3 capsule at the same time, yes, because it's a fat, the omega-3 capsule. So that's a really good idea, Anna. What supplements do men need to take? Well, I can tell you this. If you have a partner, I will give you information not only for yourself, but also for your partner to help you both increase your chances of conceiving. Obviously, my business is called Women's Nutrition, but I do work with couples and they get to be a part of this program too. Would a GP be able to recommend zinc supplement amounts and levels? No, I don't believe so. They went to medical school, they didn't do dietetics, and they definitely didn't study fertility nutrition, Rochelle. Unless they've gone and done some additional training in this space, I wouldn't expect so. What are my thoughts on acetyl L-carnitine? Sometimes it's appropriate. In terms of dosage, it's very personalized, and I'd have to have a session with UMC. Awesome. Does anyone else have any questions for tonight? Great. So just remember, you've got 48 hours. If you want to take advantage of this special offer, I would highly recommend doing so. It will not be offered again. And I only offer this program every 6 months. So just keep in mind, I only do a small intake now. If you have any questions, shoot me an email. I'm really happy to answer them. Amber, great question. I'm doing this alone, so I'll be doing IVF with a donor. Do vitamins differ? No. Well, yes and no. So supplements and vitamins need to be personalized for you individually. So they're going to differ from person to person. I don't ever give the same supplement plan to any individual. It's really personalized depending on what you're eating, what your nutrition is, what that dietary analysis shows. So, yeah. Now, some of you may have seen I have a discovery call. You are welcome to book in for that. I have opened up new slots so that you can book in for a discovery call if you want to talk about this a little bit more and have a personal one-on-one chat to me. I would love to do that. You have 48 hours though, okay? Any other questions before we finish up tonight? With regards to the pathology, Rochelle, you can get that done with your the clinical labs like Sullivan Nicolaides, things like that. So I help you coordinate all of that and work with your doctors or fertility specialists to make sure that you're getting all the right ones done. The program includes all of your correspondence with your fertility specialists. I am a holistic clinician. I work with all of your medical professionals as well. We support each other. MC, you are so welcome. It was really lovely to have you here. And I wish you the best of luck on your fertility journey. I hope you have learned something tonight, Fertility Warrior, and I promise you that I will do everything in my power to help you get pregnant. Night, night, guys. Have a good one.